Guansu picosecond spot removal, eyebrow removal operation video. Cleansing the face before operation. Project E. Epidermal pigments. Contains age spots, freckles, sunspot, birthmark. E. Recommended starting parameters. Energy from 1.5, spot 3 to 5, frequency 1 to 3, wavelength 1064. R. Clinical endpoints of the skin are. Whitening of the skin is the best condition. After a while there is a slight oozing of blood, and after a couple of days there will be a thin layer of scabs. If the clinical endpoint is not reached, the spot diameter can be adjusted down a small grid to continue the test, such as the second adjustment still does not achieve the effect, and then increase energy. If the skin lesions are severe, the spot diameter should be adjusted, and the energy should be adjusted according to the skin condition. 3. Operation interval, once every 1 to 2 months, 3 to 5 times for a course of treatment, generally 1 to 2 times after the repair of obvious results. Project R. Dermal spots in the form of dots brownish blue mole. E. Recommended starting parameters. Energy from 2.5, spot 5 to 6, frequency 3 to 5, wavelength 1064. R. Skin clinical endpoints are redness of the skin with slight subcutaneous hemorrhagic conditions. 3. Operation interval, once every 1 to 3 months, 3 to 5 times a course of treatment. Project 3. Flaky dermal spots chloasma. Recommended starting parameters. Energy from 0.3, spot 6 to 7, frequency 5 to 6, wavelength 1064. The clinical endpoint of the skin reacts with redness of the skin. Multiple operations can break up the dermal pigmentation, which is then excreted through its own metabolism. 3. Operation interval, once every 1 to 3 months, 4 to 8 times a course of treatment. Longer intervals give the skin enough time to metabolize. Project 4. Whitening. E. Recommended starting parameters. Energy from 3.5, spot 7 to 8, frequency 6 to 7, wavelength 785. R. The clinical endpoints of the skin are. There will be a tingling hot sensation, able to whiten the fine hairs on the client's face. Operation interval, once every 1 to 2 months. You can first whiten and then remove the spot, the whole face to use 3 to 4 times. Project 5. Non-invasive eyebrow shampooing red and blue. E. Recommended starting parameters. Energy from 1.5, spot 8 to 9, frequency 1 to 2, wavelength 532. R. Clinical endpoint responses were the 532版 wavelength converts colored pigment into gray black pigment, then remove melanin with 1064万 wavelengths. 3. Operating interval, once every 1 to 2 months, 532把 wavelengths will be more flashing. Please wear sunglasses. Non-invasive eyebrow shampooing black. E. Recommended starting parameters. Energy from 1.5, spot 8 to 9, frequency 1 to 2, wavelength 1064. R. The clinical endpoint response. Pigmented areas whitened. Apply a thin layer of gel. When operating, use a cotton swab to separate the eyebrows so that they do not turn white. 3. Operating interval. 3. Once every 1 to 2 months. T. After adjusting the recommended parameters, be sure to do a skin test first, as the nature of each customer's skin and its tolerance to the laser is different. So, we adjust the parameters accordingly for different items and then do skin tests according to the customer's skin test reaction. Then secondary adjustment handles spot and energy until a clinical endpoint is present as a criterion. Postoperative care. E. Timely aftercare can lower skin temperature, reduce erythema, and minimize hyperpigmentation. Cold compresses for 20 to 30 minutes, followed by 30 minutes of medical mask, can increase the water content of the skin's stratum corneum, repair the epidermis, and remodel the skin barrier. R. If the epidermal spot did break the skin, it is recommended not to touch water on the day after the skin is broken, and it is recommended to use repair products, such as freeze-dried powder, repair peptide, or erythromycin ointment. You can wipe it several times a day. When the scab, you can use saline to clean during the scab to keep the face clean and dry. Pay attention to do not use their own hands to let the scab naturally fall off. After the scabs fall off, even apply a weak repair hydration mask. Must be more hydration. If the skin is dehydrated, the pigmentation will easily precipitate and will not be easily discharged. 3. Prevent infection. Reduce inflammatory reaction. Prevent postoperative skin infection. If necessary, can be used topical antibiotic agents. Postoperative skin redness and swelling is heavy. Can be used externally mupirocin ointment by Dwoban, such as thin topical application on the trauma for 3 days, or applying scald cream. 4. During the recovery period, do not use functional cosmetics. Pay attention to sun protection. Avoid eating stimulating spicy food, coffee, milk tea, and some drinks with coloring. It is recommended to drink more water. Go to bed early and rest regularly, which will effectively accelerate the metabolism of melanin.